This now brings us to the effect of gravity on pressure. The effect of gravity on pressure. Now, first and foremost, one of the leading questions that they like to ask us on this topic, the conceptual question is, if I should ask you, in a standing individual, everything else being normal, in a standing individual, what would you expect to happen? What would you expect to happen to mean arterial pressure as in the lower, or where would you expect to have the highest pressure in the systemic circuit? Let me rephrase that question. And let me put it in the form of an actual question. Let's write a question out. Let's have fun with this. Suppose I ask, which of the following vessels is expected to have the highest pressure, the highest absolute pressure, or the highest mean arterial pressure? A, I should add, in a standing person. In a standing person. A, the cerebral artery. B, the aorta. C, the femoral artery. And D, the pedal vein. The cerebral artery, the aorta, the femoral artery, and the pedal vein. I'll give you a second to think about it. What is your choice? Well, hold on to your answer. I'll ask the question again later and see if your answer is correct and why. If you didn't get it, why? Let's explain the effect of gravity on blood pressure as such. If someone is lying down, let's say this is Mr. Jones, and he's lying down. And let's say that this is Mr. Jones' heart. Now, I know that may look like a tie, but let's assume that's his heart. On the arterial side, we know that blood leaves the aorta and blood leaves the heart into the aorta at a mean pressure of 93. Let's call that 100, just for rounding numbers. The mean pressure of 100. Because there is no gravitational effect when one is lying down, the anterior-posterior diameter is rather small. From head to toe, the mean pressure is 100. On the venous side, blood is entering the right atrium at a mean pressure of 0 to 2 millimeter mercury. Therefore, from head to toe, the pressure is 0 to 2. When we are lying down, there is no gravitational difference. Now let us suppose that Mr. Jones stands up and he's normal. How will that affect the pressure distribution in his body? Arterial side. We said the blood leaves the heart into the aorta at a mean pressure of approximately 100. When we stand up, because of the pull of gravity on the blood, as we go below the heart, there is positive gravitational pull or positive gravitational effect. And gravity can add up to 80 millimeter mercury of pressure to the system. So that by the time we reach the pedal artery, the mean pressure is 180 due to the pressure or the pull of gravity. As we go above the heart, we are losing pressure due to gravitational pull. And this is referred to as negative gravity or negative gravitational effect. So we tend to lose pressure, and maybe we can have a mean pressure of about 95 as we go above the heart. Now on the venous side, we said at the level of the right atrium, the pressure is 0. As we go down in a standing person, we are going to have positive gravitational effect. And we said it adds up to 80 millimeter of mercury. So therefore, the pedal vein on the venous side will now be about approximately 80 millimeter mercury because we're adding due to gravitational pull. Importantly, as we go above the level of the heart in the standing person, what will happen? We are going to have negative gravity, gravitational effect. We're starting out at 0. So what will happen as we go above the heart in a standing person? We are going to be less than 0. We are going to be in any way subatmospheric, less than 0. The pressure in the veins above the heart. Is this important? Yes, it is. This explains, for example, the reason why in a standing person we are not able to see the jugular vein. It's the major vein above the heart. But the pressure in the vein above the heart, especially as you stand up, because atmospheric pressure is more, will collapse the vein inwards. And that's why even though it's a huge vein filled with blood, it is not pushing out against the surface, but rather collapsed inwards. And this is the basis of the JVP test, the jugular venous pressure test, which is used to screen right ventricular failure. And I'm sure you've heard about this test before. Now, having said that, ladies and gentlemen, let us go back to the question that we've asked. And I'm going to go back and ask, based on what we've said, the effect of gravity on blood pressure. Which of the following vessels is expected to have the highest pressure in a standing person? The principle here is what? Gravity adds pressure. So therefore, the highest pressure should be in the lowest artery. So now I look down the list, not the lowest vessel, but the lowest artery, because the artery will always have more pressure than the veins. So therefore, which one is the lowest artery here? The femoral artery. So therefore, the best answer there is the femoral artery. Perhaps when you were asked this question the first time, your choice was the aorta. That seems to be a good choice because you're thinking the aorta is receiving all the pressure from the heart. But you were forgetting the effect of gravity on blood pressure. So therefore, in a standing person, the lowest artery has the highest pressure. The lowest artery has the highest pressure. And this is the impact of gravity on blood pressure. And I mentioned the JVP test. How do you do the JVP test? If a patient has right ventricular failure, what would you expect to happen in right ventricular failure? I expect that the pressure in the right ventricle will increase. This will back up into the right atrium. And now it backs up from the right atrium into the veins, superior, inferior cava, vena cava. It backs up then into the jugular vein. So the patient with right ventricular failure, it is not surprising that the pressure in his veins are increased especially in the jugular veins. And that is why, how do we normally do the JVP test? We ask the patient to incline at about 45 degrees. We observe and look for the jugular veins, and we measure the angle. Why are we seeing this bulging jugular vein? Because of the backup of pressure, which is signaling that the pressure in the system is increased, most likely because of a failing right ventricle. This entire test and principle is based on what we've just discussed, the effect of gravity on blood pressure or mean pressure. So to summarize, we talked about the upright individual, and we said that blood pressure in the dependent veins will increase because of gravity. We talked about that. Blood volume in the dependent veins will increase again. These are all gravitational effect as it pulls on the veins and increase pooling on the veins. And the circulating blood volume will decrease. Of course, if I stand up right away, I'm pooling blood into my veins. And we talked about the compliance of veins. As you put more blood in the veins, they expand. As they expand, they cannot come back because they don't have elasticity, so they pool blood even further, therefore robbing the circulating volume of return to the heart, of venous return. So therefore this explains why the circulating volume will decrease. We know that total blood volume, I'll write it as total blood volume comprised of circulating volume and pooled volume. When we stand up, pool volume increase. Therefore, this will decrease. Because this remains the same, the total. We have not lost any blood. And this is what we mean by the circulating volume decrease. Do not confuse circulating volume with total volume. Sometimes we forget that not all of our blood is circulating all the time. And this you have learned in endocrinology as well. This explains why blood pressure increases in weightlessness as you go up in space. Because in weightlessness, what happens? Because of weightlessness, because of the loss of gravity, what will happen? My pool volume will decrease. It goes the opposite. And if pool volume decrease, now blood will go shunted from the pool volume to the circulating volume. Increasing circulating volume increases venous return and therefore increases preload, therefore increased stroke volume and cardiac output. Cardiac output increases, blood pressure goes up. And that is why the immediate response in terms of blood pressure going into space in weightlessness is an increase in blood pressure, which is the opposite of what happens when we stand up and we are exposed to the pull of gravity. Of course, compensation will take place once we have that, because when you stand up, as we said, gravity pulls, you pool blood, and when you pool blood, less blood will return to the heart. Less blood return to the heart, that means I will have a decrease in stroke volume. That means I will have a decrease in cardiac output, and therefore that leads to a decrease in pressure, a decrease in blood pressure. A decrease in blood pressure will now result in compensation. This will stimulate the carotid sinus. Compensate. What will be the compensate? Immediately will stimulate the sympathetic. And what will the sympathetic do? Increase TPR, increases heart rate, which we've discussed before. So now we understand the impact of simply going from a lying down to a standing up position. And patients who fail to compensate properly are described as having orthostatic hypotension because they did not compensate their blood pressure efficiently.